Hey guys, let's go over chapter 26 for your sensory disorders chapter and start on the bottom of page 1 with errors of refraction. We talked a little bit about this yesterday. Make sure you understand the terms for farsightedness, nearsightedness, and understand that light rays not bent at a correct angle causes our vision problems. So hyperopia, remember, that's what I have. I have to wear these over-the-counter glasses that I buy because I can see far and I have farsightedness or hyperopia. And nearsightedness is myopia, and astigmatism, irregular curvature of the cornea. On page 2 of your PowerPoint, correcting errors of refraction. There certainly are some laser surgeries that can be done. Of course, prescription eyeglasses is the most easiest thing that can be done. And as people age, they have to go in and get their yearly checkups to make sure that their prescription has not changed for the eyeglasses that they need. A lot of you guys go through that. To correct nearsightedness, photorefractive keratotomy or LASIK surgery can be completed. Radial keratotomy can be done also for astigmatism. And as people age, their eyes do become drier. Sometimes that's attributed to hormones, sometimes just aging, and artificial tears can be used for the eyes. And you do have to have a doctor's order, but as we briefly discussed yesterday, older individuals can wash out their eyes with baby shampoo. And if they're able to get in the shower and just do that on their own, certainly they can do that on their own. As far as eye disorders, in the middle of page 2, uveitis is how that's pronounced. It's an inflammation of the iris, ciliary body, and choroid, causes tearing and blurry vision. Keratitis is another term that you need to be familiar with. It's inflammation of the cornea due to irritation or infection. For corneal disorders, corneal transplantation can be done. This is also called keratoplasty. And if you have trouble pronouncing that word, think of the word carrot. And this can be a replacement partial or full. And 95% of the surgeries are called a DALK. Don't have to know that for your test, but just know that these treatments are available. And there's also a corneal transplant that can be done by artificial or cadaver transplant. It takes only 1 to 2 weeks, surprisingly, for improvement. But the patient has to heal for 1 year fully to prevent infection. They can have an acute transplant rejection from this also. So watching for signs of rejection, certainly pain in the eye after the surgery is very important. Sometimes people need a corneal transplant due to genetic diseases, trauma, and it is 95% effective. There's also a treatment called polishing of the cornea, which I think your book talks about that as well. As far as postoperative care for a keratoplasty, recovery for 1 to 2 hours and then discharge home. Isn't that unbelievable for that? Pressure dressing and an eye shield. We're going to talk more about eye shields in just a second. Nursing actions focused on disturbed sensory perception. Postoperative care continued. Very important. You will have a test question about this, I'm sure, on your NCLEX, but you may lie the patient only on the back and the non-operative side postoperatively. Graft rejection is a possibility heralded by inflammation beginning near the graft edges. It must be reported promptly. If the first transplant fails, the procedure can be redone. Just wanted to emphasize again before we move away from this page how important eye care is. We mentioned yesterday about wearing sunglasses, wearing goggles if you're working with equipment that could possibly be dangerous for the eye or cause an injury to the eye or an abrasion or laceration. So very, very important to do. People playing sports, is very important for wearing eye protection if it involves a ball, or, that could be hit into the eye. Also, make sure that you review in your chapter about instilling eye drops. I think I've said that about 3 times, so be sure and read through that. You will have questions, and it all starts with washing the hands. So make sure you understand that. Also, make sure if the patient, I think it's in your book, has more than 1 eye drop to be administered, that there needs to be about 10 minutes in between instilling the second eye drop. If eye ointment is to be administered, it goes from inner to outer canthus as well. All right, eye trauma, make sure that the eye is irrigated, and it could also be a chemical burn on the eye, certainly. And the word enucleation is removal of the eyeball, or they lose the eyeball. In care of the artificial eye that is replaced, just to FYI, the artificial eyeball is sutured to the muscular structures of the eye so that there can be coordinated movement. So that means if I had an artificial eye in right now and I was looking at you, then when I changed my gaze, then they would move together, is all that means. All right, applying an eye patch. Always perform hand hygiene, cleanse the skin of the patient's forehead and cheek with a skin prep solution or pad. Prepare strips of non-allergenic paper or other tape to secure the patch. Ask the patient to close both eyes and position the pad over the lid of the eye to be patched. Secure the patch by placing strips of tape diagonally, over the patch from the cheek to the forehead. Use several strips of tape to ensure adhesiveness. If there's not a picture in your book, I don't remember right now if there is or not, look that up on the internet to just look and see about putting a patch on. And also look at a pressure patch. In the next slide, using a pressure patch, use 2 eye patches, fold the first one in half, place it over the closed eyelid. That's where you're going to get a little bit of pressure. And then apply the other patch on top of the folded one. And be sure and look up in your book about applying your tape diagonally. Like I said, I have seen questions. And when you take your HESI test or your NCLEX, of course, they may have a picture to just show you and ask if this is correct. For sleeping, a plastic or metal eye shield may be placed over the eye and secured to further protect the eye. Often the patch can be left off when the shield is placed for sleeping. I just had a note here on my PowerPoint papers to make sure you tell your patients, sometimes applying eye drops may be a new thing for them, or instilling eye drops. Certainly, you can get to be someone your age and you've never had an abrasion to your cornea or an injury or anything like that. So make sure they understand that it can cause blurry vision. Even eye ointments that are placed can cause blurry vision. An older person that's already sensory impaired somewhat, if they are going to have blurry vision from instilling an eye drop or an eye ointment, make sure they're aware and to provide for safety for that patient, even the younger person who's going to apply that. Okay, cataracts. We talked somewhat about cataracts yesterday. If you, if you did miss our Zoom yesterday, I know a few of you did. Sorry, there was a little bit of confusion about if we were going to have it or not. I thought that would just be a really good time since everybody was off on Monday or together on Monday to have that. No clinicals yesterday. But as far as cataracts, the patient will start reporting their vision is bad. I need to go get some over-the-counter glasses because my vision is changing. They may also be reporting a inability to see while driving at night. That could be reported also. Overall, that they're just not seeing as well. Increased nearsightedness. Cataracts produce an effect as if someone is looking through falling water. So That's one way to describe it. And certainly people can have cataract surgery done. It's just a same-day surgery. They go home and we're going to go over some care after eye surgery. So if you are working in an ophthalmologist office or same-day surgery clinic or something like that, very important about giving these people their post-operative instructions after cataract surgery. And cataracts can be due to aging, just aging of the eye. I know a lot of you have dogs. My older dog had cataracts before she passed away. It can be due to trauma, can be due to toxicity from prolonged use of corticosteroids. Don't think I've ever seen it, but a congenital cataract in a newborn is possible from maternal infection. And chronic sunlight. Remember we talked about that roofer yesterday who's working outside quite a bit, not wearing eye protection or sunglasses, and develops cataracts. Or that can be caused from other eye diseases as well. A physical blow to the eye, that could cause it as well. Also, cataracts are associated with cigarette smoking. Gee, everything is, right? We said steroid use also is associated with that. So the surgery removes the affected lens. So let's go over general care after surgery. Always wash your hands before instilling medication. We know that now. Check the label of the container of the medication to be certain it is the right medication. And do not contaminate the applicator tip of the medication. So when you screw off the top to the eye drop, first of all, have the paper towel down and lay it on the paper towel. Install only the number of drops ordered. Sometimes older people think, or maybe just not older people, younger people too, hey, if one eye drop is good, two might be better. So that's not true. They only need to use the prescribed amount. And your book talks about pressure at the inner canthus to prevent systemic absorption. This systemic absorption could cause tachycardia, change in blood pressure, which could cause some problems. So look in your book and read through about applying pressure with the clean finger at the inner canthus to prevent systemic absorption. Close the eye gently after eye drops. Do not squeeze the eye shut. If a patch is to be worn, changing it at least once a day, and follow the medication schedule. Maintain the designated head position and activity restrictions that are given by the surgeon. Report signs of complications, including sudden increasing pain in the eye can indicate hemorrhage. Sudden increasing pain in the eye can indicate hemorrhage. Purulent green drainage, that would be sign of infection, obviously. Decreasing vision, and signs of increased intraocular pressure, which is usually going to manifest as a headache, particularly a brow headache, like over the eyebrows. The patient needs to avoid lifting anything over 5 pounds. I'm not sure that's in your PowerPoint, but if not, add it in there. So don't lift anything over 5 pounds. Also, no straining. So no coughing, no sneezing, no bending over, no Valsalva maneuver, no vomiting. I mean, try to not do these things, but certainly to prevent straining, the patient will be prescribed to take stool softeners. Their diet, remember we talked about in OB, you want stools to be soft. So green leafy vegetables make soft stools. So drinking a lot of water, so that's important for them also. They could take milk of magnesia, I've got down in my notes, to help the stool be soft. If they do have to cough, your book talks about an open mouth cough. So that can cause less pressure. So make sure that you demonstrate that for them about just coughing with their mouth open. My sister had cataract surgery a couple of years ago, And then she was feeling pretty good, and she went home and was doing laundry. I was like, you can't do laundry after cataract surgery because that involves somewhat bending over, and you don't want them to bend over because that can cause strain. So keeping eye appointments with the surgeon post-operatively, very important. Use caution to prevent water in the eyes when showering or washing hair. This is true for the eyes or the ears. Make sure you understand that. After ear surgery. And protecting the eye, sunglasses, protective eye shields if used at night to protect the eyes. There is a period of adjustment. They're not going to immediately have great vision after this. It may take several days or a couple of weeks, but those who have cataract surgery do report a great increase in their vision afterwards. All right, glaucoma. So we want our normal intraocular pressure to be 10 to 21. So when you go in for the yearly eye exams, or every 2 years or every 3 years, whatever is prescribed for the patient, then they're going to check the pressure and do a check for glaucoma. Very important, because optic nerve damage can cause blindness. So that's ultimately what can happen with these different types of glaucoma here. The narrow angle or angle closure acute glaucoma is typically from trauma, and an open angle glaucoma is a chronic glaucoma. And remember, that is about 90% of cases. If it is treated early, it can be preventable. I have a friend who takes eye drops daily for glaucoma. All right, I wanted to refer you to look at page 605 to look at your different drawings there associated with open angle and narrow angle glaucoma. It has to do with this aqueous humor either overproducing or not draining appropriately at that canal of Schlemm that's labeled there. So that's what's going on with that. And danger signals of glaucoma is at the bottom of page 605. So be sure and read through that. Anytime in your chapter where you see a little block there where it has clinical cues, health promotions, danger, drug interactions, things like that, be sure and read through those. Sometimes test questions come from there. I know you have found that out as well. All right, so those over 40 need to have a yearly eye exam. Open angle glaucoma, signs and symptoms. Painless sometimes, so it can be hard to diagnose and it can be sneaky. So that's why these yearly eye exams are important. They will lose their peripheral vision, possibly seeing halos around objects, and they'll have an increased intraocular pressure over 21. It could be 22 to 32 possibly. And of course it is checked by use of a tonometer tool to be used to check for glaucoma. And treatments are medication or surgery. One medication we will learn about is pilocarpine ophthalmic solution, and it is a miotic which improves the outflow of the aqueous humor. So danger signs of glaucoma, we told you to look at that. Those are in your PowerPoint as well. So I'm not going to spend time reading through that. So just make sure that you go over those with your older patients who are even coming in for yearly checkups. You could ask them these kinds of questions even if you're not working for an ophthalmologist as well. Glaucoma teaching plans. Signs of the increased intraocular pressure include pain in the eye, headache, add that in, redness, tearing, blurry vision, halos around lights, a frequent need for change in eyeglasses. So they may just say, my vision's worsening. Measures to prevent increases in IOP include ingesting a low sodium diet and little caffeine, preventing constipation and Valsalva maneuver, and decreasing stress. So good teaching points there for your patients. All right. They need to take their prescribed medications and refrain from taking over-the-counter or other medications without a physician's knowledge. If I have a patient who has glaucoma in their chart, then remember, you guys are going to be wearing a name badge all the time when you're at work. You're already doing that. And you have possibly a little like pocket on your name badge or an area you can write. I used to tape on back of my name badge and write important phone numbers with a Sharpie. One of the important phone numbers I write on there is the pharmacist. So if you're unsure, you see a patient pop up that has glaucoma and you see that they're prescribed atropine, you're probably going to remember from class, oh my gosh, that could be a no-no. So you can flip over that name badge, look at your pharmacist's phone number with the Sharpie, and call them and say, hey, this is prescribed for them. Is this safe? And you know what? It could be missed, and you may be the person who finds it. So you can also look it up. I know everyone carries around their smartphones now, and you can look up things on that. But calling your friendly hospital pharmacist can help you as well, and teaching the patient to do that as well. All right. They need to identify themselves as that they have the condition of glaucoma, carrying a card in their wallet or wearing an ID bracelet, keeping an extra bottle of eye medication on hand, just like what we went through with the pandemic, sheltering place, so they might have needed to have an extra bottle during that time. Always keeping them with them because it's a daily installation of these drops. Maintaining close medical follow-up with the physician and avoid night driving if at all possible. Okay. All right. Narrow angle glaucoma or angle closure glaucoma can be a medical emergency. Intraocular pressure over 30, eye pain, headache, blurry vision, halos, seeing halos, and nausea also with your angle closure or closed angle glaucoma. Sometimes it's referred as. Reduce intraocular pressure as quickly as possible to preserve the optic nerve is the #1 goal, to preserve vision. During the attack, using pilocarpine, topical epinephrine, and intravenous acetazolamide could be used. Don't have to know that for this test, but surgery is performed as soon as inflammation subsides to relieve the pressure against the optic nerve endings. So if someone is in an accident and they have multiple injuries, one of their greatest injuries could be to the eyes. So that's something that has to be taken into consideration. A trabeculoplasty is a laser surgery that is going to increase the canal size openings for the drainage of the aqueous humor. Okay, retinal detachment. This starts on 609, I think. More prevalent in the Jewish population. And with retinal detachment, as we discussed yesterday, they see flashes of colored lights. They have degenerative changes or trauma that has caused this retinal detachment. They'll see flashes or floaters. They may have a tear or hole in the retina. They can have surgery for treatment. And the problem is the blood vessels detaching. Laser surgery, cryotherapy, scleral buckling, those are surgeries that could be done for retinal detachment. Same-day surgeries. My mother had this when she was, in her late 40s possibly. They also need to avoid post-operatively lifting anything over 5 pounds or straining. and to report flashes of lights, floaters, or cloudy vision afterwards in case that happens again. All right, diabetic retinopathy, or just retinopathy, beginning on page 611 is where that is. And remember we talked about yesterday, if you were with us, the body tries to compensate for what's going on with these damaged blood vessels, and it overgrows to try to repair, and those blood vessels are not good. They're damaged, and the blood supply to the retina is damaged. It's more so associated with nicotine use, of course, diabetes that we talked about yesterday, and hypertension. So retinopathy associated with diabetes, hypertension, nicotine use. Symptoms are blurry vision, pain also they could have, and if they do have diabetic retinopathy, their sight can be, as the patient coming in underneath your care, their sight can be greatly damaged, and so you need to, as we've talked about before, provide for safety in their environment, nurse call light within reach, not leaving doors ajar, making sure you orient them to the room. Those things are very important. This disease, retinopathy, damages retinal arterioles. Now, write this on your paper. A goal for them is to control the blood glucose and keep it within a range of 100 to 115. So we want to control their glucose, keep it in a range of 100 to 115. That can be difficult. I know people who are just treated with diabetes with oral medications, and it's hard for them to keep it within that range, but that's the goal. So that is retinopathy, damaged blood vessels, blood supply to the retina is damaged, associated with diabetes, hypertension, causes blurry vision. All right, macular degeneration. This is a genetic, most often, disease. It also causes blurry vision, seeing wavy lines, and a loss of central vision. It has increased by 25% in the past 12 years. Interesting fact, in people over 50 years of age. And we talked a little bit yesterday about these vitamins for the eyes, omega-3, coenzyme 10. There is a just eye vitamin over the counter that is a very good idea for those who particularly over age 50 to take to preserve the eyes and prevent macular degeneration. But it is associated with central visual loss, and we talked about these Amsler grid cards that the patient could be given to check their vision daily and see if they are seeing wavy lines with these Amsler grids. They do have support group for individuals who have any loss of vision, elimination and magnification of reading materials. I'm already doing that, okay? Books with large print, telescopic lenses, head-mounted low vision enhancement system, watches with large numerals. You know, all of those things can help for those with visual problems. When you're taking care of a patient preoperatively, make sure you're teaching them about when you go home, you're not going to be able to lift anything over 5 pounds, avoid straining, just like we talked about. Medications, you're going to have to teach them about their medications, how often to give them. Make sure that if it is in the right eye, that they understand that it is for the right eye and it's not for both eyes. Sexual activity, they may need to abstain from that. All right, on page 8, audience response question. After eye surgery, the patient is instructed to avoid which movements that increase the venous pressure in the head, neck, and eyes. So increasing venous pressure is going to increase intraocular pressure, so avoid straining, number 1, bending over, number 2, sudden movements, number 4, and strenuous exercises, number 5. You've got a picture of a patient with an eye patch. There we go. So you're able to see how that's taped there. And as you can see, it's taped diagonally, instilling eye drops. You have a picture where the eye drop is being dropped into the conjunctival sac. Remember that. Your PowerPoint talks about resources for the visually impaired, readers and tape recorders to help with studies. You guys are doing that right now and you're not visually impaired, so that's great. Okay, let's move over to the ear. External otitis. So, external ear infections. Yes, this can happen. So, checking the external ear to look and see if there's any redness, drainage, sores, anything like that. If someone does come in with fever, we talked about this yesterday, feeling of fullness to the ears, dizziness, you may be harder to see that with a child, but they may need a CBC and of course looked at with an otoscope. And remember, if you have someone with a mild hearing loss, to check for what? Earwax, okay? So mild hearing loss, first off, just check for earwax or cerumen in the ear and always let that work out on its own, okay? When irrigating an ear canal, the water should be tepid. Cold water and too much irrigation can cause dizziness and nausea. So checking your temperature, draping the patient before an ear irrigation, important. Okay, otitis media. This is at the top of page 9. You're going to deal with this a lot as nurses, particularly if you work in internal medicine or family practice. Middle ear inflammation is what is inflamed with otitis media. That's where the infection is. They can have pain, drainage, bulging eardrum, blocked eustachian tube. That could be a possibility following a cold, and that can cause ear infection from the drainage. I know plenty of little toddlers who have a runny nose, they're stuffy, and then they start having some difficulty sleeping through the night, pain, running a fever. Usually what's happening is they have an ear infection. And it can be a good medium for streptococcus to grow. Sometimes children who have multiple ear infections can have myringotomy or tubes in the ears that remain in place for 6 to 18 months. And so that could be a treatment that's done for them. Chronic otitis media is associated with hearing loss. And if you'll add to your paper, as I briefly spoke about, a patient who comes in with hearing loss, mild hearing loss, fever, do a CBC. If they have drainage coming out of the ear, culture the drainage, and then a Rhine and Weber test can be done with the tuning fork to check hearing. And they can have symptoms of fullness, certainly pain in the ear, and may need an antibiotic that they'll stay on for 5 to 7 days. And they, of course, as you know, need to complete the antibiotic even if they feel better. Labyrinthitis is an inner ear disease causing vertigo, usually caused by a virus, and it can be treated with something called meclizine. Meniere's disease, be sure and read through Meniere's disease. Always see questions about that on the NCLEX. Provide for the patient's safety. It causes major dizziness. It's an inflammation or permanent damage to the inner ear, causing a sensory neural hearing loss. It is tested by what's called an ENG caloric test, so make sure you read through that, which involves water being injected into the ear canal for testing. Sometimes surgery can be done for this patient. And if you will add onto your PowerPoint there, a low sodium diet controls the edema, which in turn causes the inflammation, which can cause the problem. So low sodium diet, and also the supplement ginkgo biloba is recommended for them sometimes as well. And this patient is taught to rise slowly and move slowly when changing positions. As I said, they can have major dizziness. There is a genetic link to this disease. And believe it or not, long-term stress is associated with Meniere's disease also. So write down on your PowerPoint, safety, safety, safety. You always have to consider they could fall. So a good thing to keep in mind. Acoustic neuroma is a rare benign tumor on the 8th cranial nerve, and it's usually unilateral. Symptoms are gradual hearing loss and tinnitus, or ringing in the ears, and it can be curable with surgery. If left untreated, it can cause deafness. All right, otosclerosis, unknown etiology, and it's in a degeneration of the bone in the middle ear. It does have some surgical treatment that can be done. Hearing aids can be used also. Okay, nursing care of the patient having ear surgery. Make sure you read through that section in your book also. Major thing to keep in mind is safety. Prevention of falls, prevention of infection, and a goal is prevention of injury to a facial nerve. Prevention of dizziness or watching out for dizziness, very important with these patients. So that falls underneath safety as well. And on page 10, I have a note for you to look at page 621. Instructions after ear surgery. Page 621, read through instructions after ear surgery. Some points there about avoiding air travel for 2 to 3 weeks. Just like with eye surgeries, avoid straining with ear surgery. Avoid coughing, open mouth coughing, important here too. A cotton ball with Vaseline can keep water out of the ear. They need to avoid showering for 1 week, and this is probably all in your instructions here, but that's just some tips. I had underlined cotton ball with Vaseline, keeping water out, avoid showering for 1 week, avoid air travel for 2 to 3 weeks. With a perforated eardrum, even if they don't have surgery, they need to avoid getting water into the ear. That could happen with someone who has an ear infection, that their eardrum tears. So water should not enter the ear, so that would be a good reason to have a cotton ball with Vaseline over the ear. Avoiding excessive movement for those people who have had ear surgery as well, or an eardrum repair. All right. Wanted to add a couple of more things for you to read through. Okay, read through impacted earwax, otitis media, I think I told you guys that, Meniere's disease. All right, we'll end there from now. I will send you an email if I have any additional study tips for chapter 26. And the morning of your test, Friday morning, at 9 o'clock, before we do our test, we are going to go through our ABCs, okay, with sign language. So be ready to just do it together as a group. A, B, C, D, E. Oh gosh, I forgot F. F. And we'll go on from there. So we'll do that together as a group. And we also want to practice saying my name is and spell your name out for me. So be ready to do that Friday morning as well. Okay? Thank you guys so much for your attention. Let me know if you have any questions.